Hello, this is for our Dance 4 Spine final project for the winter semester, or for the fall semester.
Hi, I'm Leia.
Hi, I'm Arlene.
I'm Piper.
I'm Kayla.
I'm Bella.
I'm Megan.
I'm Zara.
I'm Chris, and I'll be doing Vera's exercises.
Okay, so we're first gonna start off with why is our spine so important. So the reason why our spine is so important is because it gives our body support and structure. Like it just keeps our body up straight, and it could also move freely with flexibility, and and some treat or preventions like for injuries to our spine. You could always like stretch and warm up before you do any activity that's like physical, and what's it called? For treatments, if your spine needs any treatments, it could include physical therapy, rest, or heat or ice therapy, and just like medication for pain management. And how can dancers prevent back issues? And why is it so important? So, how to prevent back issues for a dancer is stretching before you dance and also cooling down after you do a dance. And then this is so important because it keeps your spine stretched and ready for dance, and then also prevents any injuries in the future.
Right, so I'm going to be talking about 3 disorders that you may have on your spine. So the first one that I'm going to be talking about is lordosis. Lordosis is an excessive inward curve of the spine in the lumbar region. It is due to an imbalance between muscles surrounding the pelvic bones. It can cause pain that sometimes affects a person's movement. People who are more prone to lordosis are people who are overweight or children with weak abdominal muscles. And mild lordosis can be cured over time without treatment, but more severe lordosis can only be solved with surgery. The second one I'm going to be talking about is kyphosis. Kyphosis is an excessive outward curvature of the spine, or a hunch in the spine. People with bad posture growing up, people who carry lots of weight, or people who lean back in chairs could have lordosis, and they're usually the causes of, or not lordosis, kyphosis. People with bad posture growing up, carrying lots of weight, and leaning back in chairs could be the causes of kyphosis. Treatments consist of changes in posture, and eventually with time, kyphosis can be solved. The last one I'm going to be talking about is scoliosis. Scoliosis is a sideways curve in the spine. It occurs during puberty or a growth spurt. It is usually caused by genetics or certain neuromuscular conditions. Severe scoliosis can be extremely painful and disabling, and treatments consist of back braces or surgery, but wearing a back brace will not correct the curve. It could only prevent it from getting worse.
So I'll be talking about spinal rehabilitation. So spinal cord and just back injuries in general can be quite serious and painful. And the best way for patients to successfully rehabilitate a spinal cord or back injury is to engage in appropriate back exercises and stretches. And it's recommended to be monitored by a licensed professional. And you may also want to apply ice or heat to reduce pain and swelling. And physical therapy is also a good option to build strength in your back.
Some common back issues, including injuries dancers may have to deal with, is lower back pain, stress fractures, torn ligaments, pulled muscles, and lumbar facet sprains, which is a sprain that can be caused by a quick, sudden movement when reaching over or sustaining an awkward back position for too long. And these common back injuries can be caused by genetics, overexertion, hyperextending your spine, and more.
So another thing that affects your spine is your nutrition. So certain foods have more beneficial nutrients for your spine. There's like 7 categories of food that's more recommended. And you don't even need to have an intense diet to have to try to support your spine, but it could be incorporated into your everyday foods. So one of the recommended foods for a good spine is plant-based proteins. So that includes things like chia seeds, lentils, and beans. And not only do they provide protein, but they also have a helpful other things like antioxidants, fibers, vitamins, and minerals. Also, vegetables, but especially kale, broccoli, and spinach, work well against inflammation and helps your spine. Salmon's also good, as you can see on Monday's slide. You could have bagel salmon lox, poke, and or just like plain salmon fillet in general. And it has fatty acids and omega-3s, which is good to promote bone and tissue health. Along with that, dairy products have a good source of calcium, which supports your spine. Go for the ones that are high in calcium, like cheese, milk, and yogurt, which fall into the category. Along with that, herbs and spices are also good. Turmeric, which is commonly found in curry, like Indian curry, like on Tuesday's slide, is good to help against inflammation as well. And fruits are also great to help support your spine. It could even be used in Tuesday slide, which you see there's like a smoothie bowl there. Fruit is sugar, but also they also have a lot of health benefits. They have antioxidants, and it helps your spine stay healthy. On top of that, avocados are also great for your spine. They're a great source of magnesium, but also they taste good as well. So you could put them in smoothies, or on Monday's slide, there's like avocado toast. And for weekly diets, all the pictures on the side are ways that you could incorporate little things to have a healthy spine.
Okay, so my section is on stretches, and for stretching your back can help reduce tension in your muscles that support your spine and improve your range of motion and mobility to heal and prevent back pain. So the first stretch is child's pose. It stretches your spinal extensors and thigh muscles. It relieves pain and tension along the spine, neck, and shoulders. The second stretch is the knee to chest stretch. This stretches your hips, thighs, and lower back. The final stretch is the seated spinal twist, and this one stretches your hips, glutes, and back. It increases mobility in your spine and helps internal organs function.
Okay, now I'm gonna talk about the 5 exercises that can help strengthen and help with flexibility in your back. So the first one is called partial curls, and partial curls can help improve your abdominal muscle, since your abdominal muscle also plays an important role to support your spine, and it also helps with your hip alignment. The second exercise is called lateral leg lifts, which it helps increase your hip muscle that supports your pelvic side and helps reduce the strain in your back. The third exercise is called Superman, which helps strengthen the erector spinae muscle and other muscles that support your spine surrounding it. The fourth exercise is called side plank, and the side plank helps strengthen your quadratus lumborum and helps release the pressure on your back. And the last exercise is called press-ups, which helps improve the flexibility in your spine and also helps with lower back pain.
And that is the end of our presentation. Thank you for watching, and